Hi, everybody. Let's see, I think we're all set here to start is this our third Google Hangout? And I have our social media team in here, and also my great young assistant, Chris Ferruzzi, who's going to help ask me some of these questions that we've had sent to us from all of our Google friends. Chris, put your head in here and say hi.
Hey,
this
everybody.
is Chris. And, okay. So let me start off then right now then, Chris. Let's see. Take a look right here too. We also have all these other questions and answers too that just came in on the list here. All right. What question do you have for me?
First one is thoughts on Botox before the age of 30.
Thoughts on Botox before the age of 30. Okay, that's a great question. You know, sometimes we'll get these high fashion models that will come in and say, you know what, I want to be proactive and prevent wrinkles. But in generally, I don't really think that's a great idea. I think if someone comes in, though, and is constantly frowning all the time, and they walk in there like this, they just have a frown on their face, that may be a good indication for having Botox or Dysport or Zeman. There's 3 types that we use now. But in general, if someone comes in with some hereditary heavy furrowing of the eyebrow or always going like this, then that may be a situation to use it. But overall, it's usually not the best way to go. All right, hope that helps. And who was that from?
That was from Kat Gilbride.
Okay, so why don't you read the names too then?
Okay, next one is from Britt Johnson. She asks, what is the typical recovery period for a rhinoplasty? What can I expect?
Typical recovery, I always tell patients they need about 2 weeks off of work. Because the first week, they're black and blue usually. They'll have a cast on. They'll have stitches in their nose. The second week, they'll have tape on their nose. That's if it's a regular full rhinoplasty or a revision. They usually can go back to work at 2 weeks. It takes about 3 months for about 70% of the nose. No, let's say 50% of the nose to heal at 3 months. 1 year, about 90%. 2 years, about 100%. The area that is the last part of the nose to heal is the tip. That's always swollen, especially in revisions or someone with thick skin. But in exercise, about 4 weeks, you can ramp it up to 6 weeks. And as long as you're in good health, you can use hyperbaric oxygen or platelet gel, some of these things that we do to help you heal faster. And thank you for that question. Okay,
the next question is from Ashley.
Talk a little louder, too.
She had radius in the cheeks a few years ago. She liked it tremendously, but
Mm-hmm.
she just had voluma and wants to know if it's normal for it to feel hard.
Voluma is another hyaluronic acid. Came out by Allergan not too long ago, and I like it. It's for cheek. She had radius, which is hydroxycalcium apatite, which is something that you can't reverse, but it's a great filler. You put that in the cheek too, or Perlane or Juvederm Ultra Plus. Voluma, though, is the new one we're using. It should not be hard. Maybe they're feeling the bone, but if you inject the whole cheek area like this and give it maybe 1 syringe, maybe 2 syringes, because each syringe has 1 cc, it should feel pretty soft. It should not be hard. FDA clearance for 2 years. I don't know if it'll last that long, though. Okay. Next question.
Jade Driver would like to know, is there a way to make my chin protrude less?
There's a way to make my chin protrude less. So that's called macrogenia, or large chin. Oral maxillofacial surgeons could actually kind of take what we call a little bit of a drill or a burr and soften that up by pushing it in. So through inside the mouth, make an incision, go down to the bottom, and start to reduce that. I don't do those procedures, but oral maxillofacial surgeons can do that. Sometimes if it's really big and the bite is off, they'll do something where they actually cut the jaw and set it back.
Next, Cynthia Parkhurst would like to know, what procedure is the most popular with patients?
What procedures are the most popular? So let's talk about non-invasive. Non-invasive, it's always going to be a neurotoxin such as Botox, Zeman, or Dysport. Most common procedures. And it's so quick. If you come in with this, it takes me actually 5 seconds to inject that area. So that's the most common procedure still. I only do face procedures. So out of the face for surgical, the most common procedures, well, maybe because it's skewed to my practice, is rhinoplasty. In general, though, I think that the most common overall facial plastic procedure is eyes, especially taking a little skin called an upper blepharoplasty. Okay, thanks.
Okay, Elise Stawars asks, what's the procedure you perform most often?
Well, since I'm a facial plastic surgeon, but what I'm really known for is noses, I'm going to say about 70% of my cases, my practice is noses. About out of that, 60% of them are revisions. Out of all my patients, about 60% of them are ethnic. The rest of the percentage is facelifts, eyes, so we'll do brow lifts, upper blepharoplasty, fat repositioning of the lower eye where I take the fat and I reposition it so you don't get hollow, fat grafting anywhere in the face, here, facelifts, chin implants, neck work, neck lifts. That's about it. Especially a lot of revision facelifts. Okay, hope that helps.
And Elise would also like to know, what's the best way to find a great and reputable doctor in her area?
Best way to find a great and reputable doctor. Hopefully you can hear Chris talking in the background. Well, first of all, you want to make sure that the doctor you're going to use is certified in those procedures. So let's say you want to have a nose job wherever you live. You want to make sure that it's a board certified facial plastic surgeon, that's what I am, or a plastic surgeon. You want to make sure they've done a lot of noses. You want to look at the results. You want to look at in reviews. You want to make sure that they have no problems with the medical board. Find out how many lawsuits they have. Word of mouth. Then go in the office and see how you like the doctor. Make sure the whole staff is nice, the doctor. Get a great exam. And then, go to about 3 different evaluations for your nose. That's about the average. Okay? Thanks.
Christian would like to know, what's the most effective for collagen induction between microneedling and laser treatments?
Good question. I don't really have a great answer for that. All I know is that we've been doing microneedling now for over a year, and I love it. Especially, we call it a blood facial or PRP facial, platelet-rich plasma. What we'll do is we'll get the plasma, which has all the growth factors in it. We'll put a little bit on the face, do the microneedling with the small machine, and then apply more of the PRP into the face. So that PRP, which helps also collagen induction and regeneration, in addition to the microneedling stimulation, you get a 1-2 punch. So that to me is a great way to do it. Plus the esthetician does it. It's in the office. It's not as invasive as a heavy laser, like a CO2 laser, where you need a good couple weeks, to not work. Because that is something that it's excellent. It's going to be more rapid, especially for wrinkles. But it's downtime and it's a real surgical procedure. Otherwise, you do the micro needling maybe once every 4 weeks. Do 3 or 4 of them. Okay. Thanks.
Laura has sensitive skin. She's 52 and she wants to get Botox soon. She wants to know if there's anything for her to worry about.
Well, you're 52. Like I'm looking right now with this camera, and I can see myself, and I'm looking at these wrinkles here. Oh, my goodness. You got to have some Botox myself. 52. Obviously you're at the right age. Maybe even in your 40s. As long as you have an experienced injector, so you don't get the risks, or there are risks no matter what, such as a droopy eye or a droopy eyelid, droopy brow, that can happen, or headaches, maybe a little bit of headache. But the chance of that happening is very, very low. So in general, just go to someone who's very experienced and they do a natural job. For example, you do the forehead. If you already have very low eyebrows and you do the forehead, you'll make things worse. Or if you do a V pattern like this, you'll get a look like that. You'll get a Jack Nicholson look. So you have to be careful and just make sure you go to the right doctor.
Okay, Jackie would like to know, what is the youngest age you would operate on? I have a 15-year-old boy who wants facial surgery.
Facial surgery. 15-year-old boy. Usually with the male it's 16, depending on what the issue is. Let's say it's a nose and a chin. 16 is about the average lowest. In addition, we want to make sure that there's not going to be a major growth spurt. So that's the age. But I wish we had a answer to that, like what type of facial procedure. If you're listening to this, send that out right now to us.
Okay, Kristen says, my mom is 48 years old and tired of looking tired. What procedures would you suggest for her to look into?
Well, first I'd have to meet your mom or even get a photo, but it really depends because when you're that age, if you're looking tired, then it's usually around the eyes, and that's the #1 area. Are her eyebrows a little bit too low, or we need a little rejuvenation? Do we need some Botox right here? Do we need, if you're hollow, do you need filler here or fat? Do you need an upper eyelid lift? Do we need fat repositioning of the lower eyelids? Because if you just take fat out in the lower eyelids, if you have fullness, you're going to become hollow. That's why we like doing fat repositioning. Do we need to do a little mini lift? We can do a little mini lift, which will help with the jawline and the cheek and the neck. It really depends on what your mom needs, and you can do non-invasive things too. We can do Ulthera or some type of radio frequency to tighten up the skin. We can do fractionated resurfacing to give you better tone. We can do fillers. We can do Botox or Dysport. So there's all kinds of things, but I would have to see your mom.
Okay. Mark would like to know, when can you have a revision rhinoplasty? It has been 6 months since my primary, and I'm unhappy with the result.
So, Mark. Where's Mark from? Indianapolis? That's a good question. 6 months too early. You got to wait, and depending on really what the issues are, minimum of a year. If it's nasal tip swelling, maybe 2 years, but you have to wait at least a year. Okay? If it's something small like a little bump up here on your bone or a little irregularity, then you can do it quicker. And by the way, Chris, there's Q&As on this, so how do I get at it too? There's some questions that people ask me about. I don't know how to do it though. Okay. Where, here? Oh, this one? Okay. Okay. Oh yeah, here we go. Oh, interesting. A lot of people are asking questions over here. Do I speak Turkish? Someone asked me that. No, I don't. Sorry. How is the recovery? I'm going to ask this one from Jennifer. Recovery from rhinoplasty. Actually, I think we answered that one. She also sent us a question there. So I talked about that in recovery. Oh, no, I'm sorry. This is from Jennifer. I have a scar on my forehead from skin cancer surgery. How long before the redness goes away, and is there anything I can do to minimize the scar? The scar is about 2 inches long and horizontal. So that means that you had a skin cancer and they closed it here, stitched it, especially if it's fresh, it'll be red. Make sure sunscreen. 2, you want to use some kind of a scar gel which has a silicone base to protect it. You want to wear a hat to protect it from the sun. They can do a laser on you called a pulse dye or V-beam laser. These are the things that you can do right now. Later on, you can even do microneedling on it. And then for some reason, if it heals really, really bad, you can have a revision after that. Okay. Let me just look at something here. Okay. All right, Chris, what's your next one?
We have another rhinoplasty question from Bethany. She wants to know what types of cartilage do you use for grafting?
Bethany, Boca Raton. Cartilage. What type of cartilage? The first thing we always want to use is the patient's own cartilage. And if they have nasal septal cartilage, so especially if this is for rhinoplasty, inside the nose of the nasal septum, on both sides of that, we're going to take cartilage out if there's enough. If it's a primary rhinoplasty. Sometimes we'll take cartilage from the ear in this part right here. And if we need a lot of cartilage, we'll take it from the rib, small incision about that big, right underneath, if you're a female, right underneath the breast crease. And the male, just at the lower aspect of the chest. Oh, thank you. Jennifer just said thank you. My pleasure.
We have a Botox question from Brian in Georgia. I see way too many people who look like they can't move their face. It's very obvious to me they have had Botox. I have wrinkles I want to fix on my forehead, but I'm afraid of having a frozen look. How can I prevent this from occurring?
Good injector. If you go to someone and you say, I want to have some movement, some residual movement, then, and by the way, most good doctors are going to give you some movement so you don't look fake. And I think you have to discuss that with the doctor, and because usually what they'll do is use lower dosing. Okay. And by the way, is this from the YouTube? Is this from the Google? Those questions that just came in?
You did.
Yeah. And then how do you do that also? Plus, if we're doing live tweeting right now. So if you guys have any questions from the Twitter, shoot them over also. Fire away.
Okay, we have a question from Sadie.
Mm-hmm.
Can I work out right after having my Botox treatment? I have a spin class to attend and don't want to miss it.
Can I work out after having my Botox? I like to tell patients 3 hours. But if you do it in the morning and you want to do spinning later on, And by the way, just this last weekend, I went to spinning Saturday and Sunday, and it was a great workout. I mean, it was an excellent workout. I probably burned, I'm guessing, around 600-700 calories. Boy, fantastic workout.
Okay. Mary from Iowa wants to know, what's the best filler to use for the laugh lines?
Laugh lines, right here. You can use one of so many. You can use the hydroxycalcium apatite, which is radius, which is non-reversible, or you can use any one of the fillers, the hyaluronic acids, and you can use Juvederm Ultra Plus, Perlane, Restylane, Belotero, any of those. So it just really depends also what the doctor is comfortable using. I usually like something with a little bit more bulk, so I'll usually use something with a little bit of a lift, such as Perlane, or even Juvederm Ultra Plus.
Okay. We have a question about eyelid surgery from Desiree. She said, I feel like I can't see my eyelids, but when I move some skin aside, they're more apparent. What surgery would I need to fix this?
Well, every time we're looking at the eyebrows and the eyelids, we have to look to make sure that the eyebrows haven't come down too much, causing excess upper eyelid skin, because sometimes doing a conservative brow lift, conservative endoscopic, just gentle, can take care of the problem. Most of the time it's upper eyelid skin. That's some excess, and we'll make a little incision right across the crease of the eye and take away some skin. Is that the gist of the question? Basically, they're asking more about, the extra eyelid skin, correct? Mm-hmm. Okay.
Okay. Jackie wants to know, can my 15-year-old son undergo facial surgery for forehead, nose, and chin? That was an update from the question before.
Okay, that was the person. Okay. Forehead, don't know what you mean. Chin, if it's augmenting the chin, and the nose, I'm still going to say 16 as long as there's no growth spurts. I don't like operating on males until they're 16, plus they're more mature at that time. The other thing that I do on all my patients, but especially on children or teenagers, I get a psychological clearance just to make sure they know what they're doing, make sure they're realistic, to find out what is the real reason why they're doing the surgery, and get answers like that so that I know that I have to be very comfortable. But in general, that's about the right age, around 16.
Okay. We have a facelift question from Don.
Okay.
Wants to know, how long does it take to perform a facelift, and will I be asleep during the surgery?
How long does it take to perform it? Depending on what we're doing. If we're doing like a little mini baby lift, something really small can take about 3 hours. Or a very extensive, heavy revision facelift could take 6 hours. 95% of my patients will be under general anesthesia. 5% of them want to stay awake and do under local. And we'll give some shots to up the area, and we can easily do this under local. But most patients, 95%, do it under general anesthesia. Here, let me ask someone a question. I know you have those. Let me ask this one. I like how they come up on this Google Hangout. Fabi, hope I'm pronouncing your name. My niece, who is a little over a year old, has one hand where her fingers do not grow in. Is there a surgery which can help her? Unfortunately, I'm a facial plastic surgeon. I think the best thing to do is start off with your pediatrician, and they may refer you to a hand surgeon or something like that. And that's probably the best way to answer that. Another one, I am interested in having my lips enhanced. What are my options? I don't want to look like a duck. Great question. If you fill the vermilion border, which is just right along the top, right through here, and you overdo that, as a matter of fact, when I was spinning, good question, this is interesting. The person was right to my right. I looked, and all I can see were these duck lips. And I'm looking, going, oh my goodness. And so, especially if you overdo it, it will look horrible. What we want to do is actually fill usually the volume of the red part of the lip. And that's more natural. We don't want to overdo it. So don't overdo it, and you want to do it in the right plane. My pleasure, Fabi or Fabi. Just said thank you.
Martina would like to know, what has been the most popular anti-aging procedure in your practice?
Well, anti-aging, all these almost are anti-aging. But I have to say that, for just preventing things, besides injectables and fillers, because these are all great anti-aging things, and surgical procedures, I think that doing the microneedling is something that's kind of cool because it stimulates collagen. You're using the platelet-rich plasma, which helps you stimulate new growth of collagen and helps you, decrease your pore size and makes your face look a lot better in addition to the microneedling. I think that's probably one of the new things that I really, really like.
Okay.
Boy, someone keeps texting me every second here.
We have a question from Natalie.
Yes.
I heard a brow lift can be performed using a camera with minimal incisions.
Yeah.
Is this something that is possible?
Yeah, that's an endoscopic brow lift, and that's pretty much what I do. But there are 5 small incisions usually. One in the temple, one up here, one middle, one over here, and one in the temple. 5. And sometimes you can do this with 3 or even 2. But we use a endoscope, a small camera, and special small instruments to go inside to pretty much lift up all the muscle all the way across, lift up the eyebrow naturally, and then fixate with little stitches or little absorbable screws that dissolve after about 9 months. Right through here. That's brow lift. We got another question too.
Okay.
I know this isn't a facial plastic surgery question, but are you into technology and do you think 3D printing is going to play a part in plastic surgery? I don't know about 3D printing, maybe. I don't know much about it, but 3D photomorphing and stuff would be fantastic, and I know they already have that technology out. Because if I'm doing a change with my photomorphing right now, let's say a hump, or I'm deprojecting the nose, I'd love to have that incorporated into 360 degrees, not 380, where it changes everything on the face. On that nose, so that one change that you make with the nose in a 2-dimensional nature will give us a 3-dimensional outcome. That'd be great. We have more?
We do.
Oh my goodness.
Marshall wants to know, is there anything that can be done at the same time as a facelift to enhance the overall result?
Yeah, can anything else be done at the same time with a facelift? Yes, I mean, you can do your brow lift, your eyes, your cheeks, fillers. You can do all kinds of things at the same time with a facelift. On your face we're talking about. As long as you're healthy and we have enough time in regards to not spending too much time in the operating room. But absolutely. Most patients will come in for a mommy makeover of the face pretty much, and we'll have everything from here down to the bottom of the neck done.
Okay. Michaela is scheduled for an appointment to have Botox at a physician's office, and they're going to have a nurse practitioner doing the injections. She's a bit worried about that and was hoping to have the doctor do it. Is it safe to have a nurse perform the injections?
A lot of nurse practitioners and PAs do Botox, or just regular RNs do Botox, depending on the quality of them. I mean, I don't personally use one. I do it all on my own, but a lot of my friends do. And if you have a good injector, it's fine. You should have no problem.
Okay. Michelle has a rhinoplasty question.
Okay.
My nose looks uneven from underneath. Does this mean that my septum is deviated? I don't have any trouble breathing, but I just want to try and make it look more symmetric.
Good question. It's from the bottom view, the base view, from looking up here. It depends. Most of the time it's from a deviated septum. And I'll bet you if I examine you and kind of isolate one side versus the other, you will have some nasal obstruction, especially if there's a pretty gross deviation, which means, I mean gross, that you could actually see it from looking at the base. So most likely that's what it is. How do you address, I'm going to answer this one. How do you address the excessive fat skin in my neck? Fat. We can do liposuction to a small incision here and one underneath each earlobe, like a little small incision that big. Do a little lipo, as long as we don't overdo it. At the same point, if we want to tighten the neck muscles, we either approach it to an incision underneath the chin or a little one back and behind the ear, and we actually pull the neck. And that's for the neck. We want to pull it back, because pulling the neck this way is okay, sideways. At the same point, we're going to do, if we're doing the rest of the face, we're going to lift everything up vertically, like this. Now, obviously, you're not going to see all these wrinkles. I'm just kind of showing you the idea of going up and natural. So we can actually have a very nice jawline. That's one of the important things, though. You've got to make sure that you look very, very natural. Somebody asked me a question about botched. I think I can answer a little bit. By the way, I don't know exactly when, but stay tuned. Maybe this summer. Can't give you an exact date, but who knows? Maybe even in June. But on E, it's going to be called Botched. It's Dr. Terry DeBro and I have a show, And basically what we're doing is we're fixing patients that have undergone some horrendous surgery of the body and the face, and we're making these patients better. And it follows the lives and the stories of the patients. It doesn't get into my personal life that much. I think I had enough of that for a while. But it gets into us at the office. So watch, you got to watch it. In addition, I'll have my new skincare coming out called Nassif MD Skincare. And I think in the next 8 weeks when we do a Google Hangout, we'll show it and we'll talk about it and stuff. That'd be great. Okay, let me see, move your hand. Okay. Yeah, that was a question about, botched. It's, we're finished filming. It's in the can, as they say, and the surgeries were very, very, very difficult, but you're going to have to watch it. I think it's going to be a fantastic show. It'll be very interesting. And this is from Danielle. Are the cases extremely difficult? Absolutely. That's why you have to stay tuned and watch and see how hard these cases are.
We have another question from Marcel.
Okay.
Wants to know, are there any side effects of using filler to mask a nasal deformity?
I'm not a big fan of using filler in the nose because I've had patients that had filler in the nose and they've pretty much come back and the nose has collapsed because they've actually had an infection or compressed a blood vessel, it was inadvertent, and they lost the skin. So I'm not a big fan of using fillers. However, let's say you have a little depression way up here on the side of the nose, and once in a while you want to use a little filler, you should be okay, but the doctor has to be very gentle with that.
Okay. We had a Botox question from Mary. She's going to be 25 in June. She feels like she has wrinkles on her forehead when she makes certain expressions. Is now a good time to treat the area with Botox, or would it be a waste of time and money?
I think everyone has, lines when they raise their forehead. I think it might be too early. Unless at rest, just like this, you have wrinkles like I have. Then that might be a different story. But at 25, I'm going to say don't waste your money now. Just good skincare, no smoking, drink a lot of fluids. Living healthy is good for your skin. Someone told me, by the way, that I haven't seen this yet, but if you exercise a lot, they've actually taken biopsies of patient's skin in the epidermis for that patient who doesn't exercise, and then they get them on an exercise regimen for 3 months. There's a significant change, better collagen formation with the patient who exercised more.
Okay. Our last question is from Kat. She wants to know, what precautions should we take to avoid any sort of skin cancer?
Don't lay out in the sun. And if you're out, wear sunscreen every day. And if you're going to be in the sun continuously, you want to wear sunscreen, a great titanium block or some type of a zinc, at least 15 minimum of SPF, and reapply it every 4 hours. But always wear a big brim hat if you can to protect your whole face. And the décolleté. Is that it?
Yeah.
Okay, I think we're done with this. Thank you all, and I'll see you on our next Google Hangout. Have a great weekend. Thank you.